Hi everyone, just to see if my audio is working. Hello? Testing.
Hello, hello, hello. Thank you for coming. CB4 meeting. We also have a public hearing. It's 6:04. We're going to get started. Hello. Today, Wednesday, November 19th at 6:05. Thank you, Celeste.
Just for the record, the recording was started afterwards. It is 6:04 when we're getting started, Wednesday, November 19th, and we'll begin with our public hearing items, starting with Wyckoff Hospital, the introduction of the new Chief Executive Officer and President. Welcome.
And you're also on Zoom, so you're gonna have people outside, and you're gonna be all right.
Hello, can you hear me? Wonderful, thank you. So, first of all, thank you for having me here tonight, together with my executive team from Wyckoff, and giving us the opportunity to introduce ourselves. It's my first time here, so I'm gonna try to tell you a little bit about myself before I start talking about Wyckoff, and then we'll be open for questions. I've been Wyckoff president and CEO since January of this year. So I'm relatively new to the job. I feel like I'm still fresh into my job. But I'm not new to Wyckoff. I've been with Wyckoff since 2013, so 12 years now. And for the last 7 years, I had the role of chief financial officer, trying to keep the hospital open. So I'm I've been ingrained in numbers and financials. Prior to that, I had other various roles in the finance department. Actually, my entire career is in finance. To be more exact, it's like a quarter century. Today, of 25 years of hospital healthcare specifically experience. I started a downtown hospital, near a downtown hospital in 2000 when I moved here to the States. So again, it's been my entire career in hospital healthcare since I came here. Very often I get a question where I'm coming from, and I tell everybody I'm coming from New Jersey, and that's the truth. I come from New Jersey to Brooklyn every day, but I think people mostly want to know where my accent is coming from, so I'm going to try to give you a little bit of background about me. I was born and raised in Romania, up in the Carpathian Mountains on a very small farm. So never thought, I'm going to be here speaking with you in your city. I was also educated in Romania. I finished the bachelor in economics, majors in accounting, finance, and banking. And I also started my career overseas. That's where I spent my first 7 years. In a wine industry, not at all in healthcare, but I can tell you I still, use what I learned at that time today. So in 2000, after exactly my 30th birthday, my husband and I decided to get on the plane and cross the ocean. Of course, we are looking to start a family. And like every immigrant, right, here and across America, we are hoping if we start a family here, we offer better opportunities to our kids, especially me growing up in a socialist country. At least I felt like, I didn't have a lot of opportunities growing up. So that's basically my story as a person. And again, I'm glad to be here tonight to talk a little bit about Wyckoff, about where we are and where we want to go for us as an institution, but also for the community overall. So let me just make sure I turn off my phone. Okay, so first before I start throwing all kinds of numbers at you guys, because I think, it's important that I give you some numbers so you understand where we are in terms of geography and our volumes. I want to introduce my executive team, right? Because everything I'm going to talk about, I can't do it myself. I may be the face of Wyckoff, but I have a lot of people behind me who helps me with the operations every day, and they help this community as well. So I'm going to start from right to left. Dr. Del Toro, I think some of you may know him from previous meetings. He's our chief medical officer. He has been with Wyckoff for over a decade. And I hope everybody has seen in the community the work and the quality of care and how much it has improved since he took this position at Wyckoff. Next to him is Kathy Simon, Dr. Kathy Simon. She's our chief nursing officer. She also has been in Wyckoff for over a decade, so all our nursing care is in her hands, and she also has done a tremendous job in increasing the quality of nursing at Wyckoff. Next to her is Christine Scaminacci. She's our chief operating officer. She's a newer member of our team. We didn't have this role prior to January. And we definitely feel like this was the best, decision we made to create this role, because you'll hear me talking about Wyckoff and how many things we're doing, and she's playing a vital role in finishing those projects. Kiana is my assistant. I think everybody knows her. So if you want to get to me, you have to go through Kiana. But she's basically the best executive assistant somebody can ask for. And next to Kiana, we have Kevin Smiley. I think most of you know him as well. I don't have time to quote all his titles. It will take me the entire evening. But the most important ones, he's our legal counsel, a chief compliance officer, and he's also handling our public patient affairs, specifically patient experience. So he's well connected to the community and, hearing what we need to hear from your end. With that being said, I do have a small presentation. I don't know if that's being shared anywhere, but I can start over there. Okay. So I don't know if on this side you guys can hear me well. Am I talking too fast? I do talk very fast. Okay. Thank you. So I think you probably all know Wyckoff, right? It's your community hospital. I'm just going to give you an update of where we are this year in 2025, since we are almost at the end of the year. I felt like, rather than giving like a quarterly presentation, I can tell you we're almost at the end of the year, and I can tell you where we are. And of course, at the end, I'm open for any questions that I can take from you. So you all know we are a safety net hospital. I don't know if you know exactly what that means, but to give you some context, a decade ago, there were about 20 safety net hospitals across New York, and those are the hospitals who serve mostly patients who have a government insurance. In Wyckoff case, we have about 65% Medicaid eligible patients and about 34% Medicare. So over 90% of our patients hold a government insurance, and we also generating operating losses. So, those criteria make the definition of a safety net. Again, like a decade ago, there were like 20 hospitals across the entire state. Now there are over 64 hospitals that are safety nets. So the numbers of those institutions who serve communities and, have financial difficulties is growing every year. And I think most of you know why the trend, right? In regards to what is it that we are serving here in the community, we provide medical care, not only medical care, but what's important for Safety Net Hospital, we always try to address the community needs. So we basically screen for social, health, and economic disparities. And this community has some of the most severe in New York City. When we do our community assessments, we score very high on the social needs of the community and what are the most prevalent diseases that we see in the communities. We're talking here about diabetes, cardiovascular diseases. We talk about hypertension, cancer, and pulmonary. We offer all of those services at Wyckoff, some of them in a limited capacity, but the intent is to make sure our strategy going forward is to address these diseases and to prevent them. And I can talk a little bit about that if we have enough time this evening. So another statistic, about 36% of our patients have Spanish as their preferred language. I think is no surprise to you here, right? And about 64% of our patients are Hispanic, but only about 36 prefer Spanish as their main language. There are the languages spoken here. I think it's probably one of the most diverse communities in terms of how many languages we're speaking. But other languages include Arabic, French, Polish, Bengali, Chinese, both Mandarin and Cantonese. Romanian is among the languages that's spoken in this community, so happy to see that as well, and Albanian. I think that's about it in regards to the statistics for the population in the community. I don't know how many of you know, but we also a teaching hospital. We have a lot of teaching programs on a yearly basis. We teach over 200 residents, interns, fellows, nursing students. So our academic environment is very strong, and we plan to expand on that. As you can see, we have all the specialties there from internal medicine, pediatrics, OBGYN, emergency medicine. We have a strong residency program. We have dental medicine, one of the most successful residency programs in the entire New York City is our program. At our hospital, we have pediatric dentistry, general surgery, podiatry. So we pretty much cover all areas of training, and we're very proud of our academic programs. I think we also are the hospital in Brooklyn with the highest number of grant-funded programs for the community. We are currently running 20 grant-funded programs, which are basically programs that promote health in the communities. We're serving about 8,000 clients annually on site at Wyckoff. So I hope most of you are familiar with those programs, but the majority of them are centered on care coordination, case management, outreach and follow-up, benefits navigation. We do a lot of screenings and linkage to care. We have behavioral health services that are grant-funded. We have community education and engagement, counseling, education, support, and I think this is probably more to list, but again, we have 20 grant-funded programs, very well recognized across the city, and we have the biggest numbers of these programs. So for those of you who will be interested to learn more, we're more than willing to provide you further documentation after this meeting. Some statistics here, I don't think you can see them, and I don't want to misquote them, but just in terms of how many patients we serve as volumes, we have 80,000 unique patients. So that's a lot, right, for a small community hospital. And of course, these unique patients, they may have 1, 2, 6, or 10 visits. And you can see in the same box we listed that these 80,000 patients give us about 330,000 outpatient visits annually. So we're pretty busy on the ambulatory side. We are serving these patients with about over 2,000 doctors, nursing, and support staff. So we are a pretty big employer in this community. And actually, we have a lot of our employees coming from the community, including our volunteer programs. A lot of kids come to our institution, and they fall in love with healthcare, and they follow healthcare careers. And we want to make sure we actually expand on those programs and bring more of the community awareness about healthcare, the future of healthcare, and how can these kids pursue these careers. It's not easy to be in healthcare, and we want to see how we can further encourage these kids to join us in providing healthcare for the community. Like I said before, about 80% of our patients have Medicaid or Medicare insurance. I think I spoke about that. Over 40% of our patients have limited proficiency in English. That's why we have a very robust language assistance program. So patients who come to Wyckoff, they just have to request for assistance, and pretty much we offer any language that's preferred by the patients to know about their care. So I highly encourage everybody to take advantage of that. We have, in terms of the social needs in the community, and I'm going to talk a little bit more about this in the following pages, but we're showing, statistics show that 26%, there is a poverty rate of 26% in this community, which is higher than other communities in New York City overall. Also, we're showing a 44% child poverty rate, which is something that we learned about a couple of years ago. So we put some programs in place to address that. And we want to expand on that initiative to make sure we do outreach to community-based organizations, to school, and we also have programs in place that support education on nutrition and diabetes prevention. So that's, I think this year we opened some new clinics on that, and very eager to find out the impact and the results on the community. And we also learned through some surveys that 50% of the households are actually rent burdened. So I'm going to talk a little bit more on the following pages on what we call social determinants of health and screening. So this is a new program that the state is offering. It's called the 1115 waiver or a HEAD program. So I think they finally, at the policy level, they understood that the patients in the community we serve are very complex, and just because we treat a medical condition, that's not sufficient to keep them healthy. So we have to be more aware of all the environment and everything that's happening outside of the time they spend in our healthcare facility. So most of the patients who come to Wyckoff now, they are screened for what you call these social needs, meaning they're going to be asked a series of questions about, what do they struggle with when they go home? Do they have concerns about, do they have food insecurities, rent insecurities, and so on? So with these programs, we're able to hire more community health workers, and we are in the first year of starting to screen the patients and understand the extent of the community needs. So I think so far, I think if we can go to the next page, I already skipped over the statistics. And I think I skipped over this one, but I can talk about it. We tested from April through September of this year. in our interviews and in our patient screenings, I think, let me see where that slide is. Put too many data in here. I'm sorry about that. Okay, so too many numbers. That's the problem when you come to the financial side of things, you're always stuck with numbers. So here is, I found this. So we had 359 positive screens for food insecurity. So that means from the patients we interviewed from August through September, so that's a small time frame, about 20% of them said that they have food insecurities. And from 330 patients that we screened, we did on the past 12 months, the food that they bought just didn't last, and they had to go get money to get more food. So about 18% of those responders, again, food insecurity seems to be one of the biggest concern. And on the third place, about 17.4% as a number that screen positive was 318 patients. They said that they do not have a steady place to live or a place to live today, but even if they have a place, they are worried about when they're going to live in the future. So why we're screening for all this community concern is because it's very, very important for us as clinicians and healthcare providers to understand when we discharge a patient or we send them home, can they really afford the medication? Do they have a place to live? Can they manage their chronic conditions if when they go home, they have various, situations in their apartments that contributes or trigger their diseases? So I think we're slowly moving from just treating patients to really understand how we keep the patients healthy in the community. Of course, we want the patients to come to WICO, but we want them to manage their diseases, and we want to make sure we understand the cause of those diseases and try to give them enough information and education so they can help all of us prevent those conditions going forward. I think I've been skipping 2 pages, but I thought that's very important as a new program for the community that the state is putting forward. And WICOF is among the first responders to the state. We actually, according to the recent records, we have the highest number of screenings submitted to New York State in blocking. So we really very serious about making sure we understand the community needs beyond their showing up at our door with certain conditions. What else I can say? I can say a lot of things, but let me see what's important. I think if you can go back, I want to show is a page with our recognitions and accreditations. I think very often people think that, if we are a hospital with a lot of financial challenges, right, we may provide maybe not the care that Mount Sinai or NIU can provide because, of course, they have billions of dollars in their bank account, right? But that doesn't mean that a small community hospital cannot perform care at the same standards, is not higher, right? So here on this page, I'm showing some of the most recent recognitions that WICOF got. The most recent one, we got the Platinum Award for our cardiac program. I think we are maybe the only hospital in Brooklyn with this recognition of Platinum this year. And in our scores, we actually outpaced bigger systems like Lenox Hill, Mount Sinai, NIU, meaning our care is above, from a quality perspective, above the big systems. There are just probably 40 or 60 hospitals in the nation with this designation of Platinum Award. So I just want to assure you that we may be a small hospital with no money, but that doesn't mean we're going to compromise on quality of care, and we intend to continue on that path. I'm not going to go through all the awards we received. We have strong programs across the board. We have a beautiful new pediatric emergency department that we just had a ribbon cutting ceremony last week. Mr. Camacho and Celeste were there. We're planning to invest, and one may ask, how do you invest when you make no money, right? So we have been receiving support from the state. We are constantly applying for grants. So most of our investments are the result of us applying for various grants. And we have some significant projects going forward. We're going to renovate our adult CD. Within a year, we hope we can cut the ribbon for that. And we also want to invite you, if you want to take a tour of our new pediatric emergency department, you can reach out to Kiana. We have open houses for our community to see what we have done. Like I said, in a year, I hope we can do that for our adult CD. Just as a perspective, so you know, we see about 84,000 ED visits per year. So we are very busy. We're one of the busiest emergency room in Brooklyn. We also have about 12,000 admissions per year. This is not a very big number, but it's definitely important to know that we offer all these services. We have probably in 2 or 3 years, I don't want to get ahead of myself, we plan to open an entire comprehensive diabetes center, which is 2 blocks away from hospital. It's also going to be probably the first diabetes center in this geographic area. This is going to be developed also with a grant from New York State. It's about $25 million. So we're very, very excited about that opportunity for the community, and we hope we can do that as well. We're planning to open an urgent care center also on Myrtle Avenue, not too far from where our clinics are. And we also received funding from the New York City Council, some of our local representatives, to renovate our 11 and 12 floor. We have there the labor and delivery service, maternity services, NICU. Our NICU is there, newborn, and pediatric services. So we're going to try to do all of this in the next couple of years, again, with a lot of support from various grants. But I just want to assure you that we're not going to stop thinking, oh, we don't have money, right? We have to find ways to still invest, because without investment, right, in our facilities, we cannot provide the care that's expected from a healthcare facility. So I can talk for 3 hours, but I know the time is limited. I want to thank you so much for listening to me. I don't know, I can take questions now, or if the time doesn't permit, we can.
Yes, I want board members, please raise your hand. Then I would have any other visitors that have any concerns or issues, or let me get him, then I'll get him. Anyone else? Oh, behind, I'm sorry, then I'll.
Good evening, James Stewart, CB4. No, you mentioned
James.
about the systems. Is there any thought, knowing how the healthcare climate is, and me working in healthcare, I know this to be the case, being at a small community hospital in Long Island that went into Mount Sinai. The future of Wyckoff, is it to remain a small community hospital or to become a part of a healthcare system?
Our Board of Trustees, for now, they would like us to remain a small independent community hospital. We have strong clinical affiliation with Northwell Health, but we're not talking about a merger at the moment. Our board, again, believes that a hospital our size will better serve the community rather than a big system who we all know, they provide excellent care, but we believe for the community, our board, at least at this moment, does not entertain a merger with a big system.
Stephanie Anderson, CB4. How are you tonight?
Hi, Stephanie.
Thank you so much for coming. Years back, someone came in and mentioned a defibrillator class and how it would be advantageous for homeowners or building owners to have that on hand, and they actually gave the people that took the class a defibrillator. Do you still have that program in hand?
I can defer to my clinical leadership here. I think I am aware that we had such a program. Kathy, I see her nodding. What do you know about where we are today?
Yes, we did have a program, sorry. Several years we did have a program, and it was run by the nurse educators who provide ACLS and BCLS to all the staff. We did come to, I'm believe we came here as well, the staff came here, but they have been going to different community centers and to the grammar schools to provide education in CPR and basic life support skills. And an AED would be something that they would have done in their training as well. And if there was a time that you wanted to set it up, certainly we can have the educators all come, all fluent in Spanish speaking as well. So they would be able to provide the services and provide the education. Okay.
Good evening, everyone. My name is Felix Ceballos, a CB4 member. Thank you for job here. It's very important, like community, we know how the White Coast Hospital doing. Thank you very much. I have a question. In any time, ICE, Department of Immigration, they show there? If they show there, how was White Coast Hospital doing with that situation? Thank you.
I can talk about it, but I would like to see if Dr. Del Toro would like to talk about how we address clinically that. Of course, first we are a hospital. So we have a protocol in place which was designed for all the hospital with the help of Greater New York Hospital Association. So if a patient is under treatment at Wyckoff, ICE cannot go in and just take the patient while is undergoing treatment, right? Once the patient is finishing its treatment, we have no control over what the federal agencies are doing. But our policy from a medical perspective, if somebody is in our clinic, in our inpatient, somebody is on dialysis or on an inpatient bed, while the patient is under treatment, we do not allow that treatment to be interrupted or disturbed. Dr. Del Toro, do you have anything to add on that? So I think pretty much I'm summing it up. Did I answer your question? Okay.
Hi, Jason Gers, CB4 member. I live over by Palmetto and Irving, and at one time I saw a sign that it was going to be a children's center or children's health clinic opened over there, and I'm wondering if that is still in the works, because the sign, I believe, is no longer on the building. Thank you.
Great question. And I actually just got a recent decision made, and that's why the sign was taken down. So that sign was there because we applied for a grant that was supposed to develop a site there. We were awarded an amount a couple of years ago. That's why we put a sign up. But in recent developments and discussion with the state, when we tried to apply for the CON, the site was not considered meeting the criteria for the state to disperse the funds. So we had to basically, kind of withdraw that type of plan. We did not lose the award or the money. The state allowed us to finish the diabetes center or needed money to build the third floor there, but we do not have that. That is off the table at the moment, right? So unless we secure other funds, we are still looking to see what else we can do in that facility. But that's the reason we took the sign down, and we do not believe it's appropriate for healthcare from the state perspective in terms of what is needed. You're welcome.
Anyone else? Seeing none, I have, and then I think my district manager have. I'm just curious. I see here you got key updates, 2025, capital improvement projects that are coming on the pipeline. I'm just curious on what is the 1115, I think it is.
Roadmap, yeah.
Yeah, what is that, and how is it medical waivers, and how does that work? Or what is it that you guys are applying? And then I have a couple of other very concerned issues that I may have.
So let me try to address that question. So I think I mentioned earlier when I talk about the social needs screening, that is part of what we call 1115 waiver program. 12 hospitals in New York City participate in this program. It's a program run by CMS with state participation. To be exact, what it means for Wyckoff, we're getting about $46 million per year, which of course significantly helped us close our budget gap. And I'm listing on that page the type of services where the state wants us to invest money. Basically, they give us money to invest in what they call services needed in the community based on, of course, community assessment. And we talking here ambulatory care expansion, and you heard me talking about where we want to go. It's all ambulatory, patient experience, language access, care coordination. I spoke about social determinants of health, data systems improvement, tracking and reporting. So definitely it's working. The program is limited, so it's only running for 4 years until March of 2027, at which point we are supposed to join a hospital global budgeting model, meaning we're going to get reimbursed a certain amount per year regardless of our volume. So what we're doing now, we're preparing for that new model of care.
Oh, that's great. But are you under your RFP or whatever you apply for? I don't see a community advisory board. I know other hospitals, others do have a community advisory board to assist you. I know you have a board, and I know some of the people on your board, and we've been dealing with this with you guys. I don't know if you RFP or whatever criteria you have in regards to that. There needs to be one. As myself, speaking as myself, with my wife and a community hospital that's been here all our lives, seeing her father passed away there, her grandfather passed away there, her grandmother passed away. There's a stigma, and there's a stigma in my family, and there's a stigma in some of the people in the community that I know in regards to, I know, new face, new ace. That's the way I see it. But in order for us to continue to support this hospital, I know the elected officials are doing their best because that's their job to do. We are the community, and we are the ones that go to this hospital. We are the ones that visit this hospital, see our families go there, and sometimes we have concerns and issues and they're not heard. Sometimes people just put a check in a box that they did, and that's kind of disheartening. Sometimes our nurses, they know they have issues and concern, and we know there's a problem, and they take it out on some of our loved ones. Not saying that you do. I'm not putting any, I like to put everything on the table, only because I go home and my wife sees me trying to help the hospitals in our community when there's a stigma in her family thinking that every time she hears it, it reminds her of her parent or her family not being treated the right way. Is there a community advisory board? Are you going to put people in this community advisory board that are stakeholders that live in this community and that have people that go there constantly? So we can work with them and also work with the executive board that you guys got there. I know Sam from the pharmacist. He's supposed to be the chair. I know him a long time. He has business in Bushwick. He's the chair of your board of directors there. And so is a young man that I know too for a long time that his wife is a judge, Montalban. So I know them very well. I don't want to go knocking on their doors for that. I want to make sure that this community, and you also in this thing here, I see that there is an assessment and a community health needs assessment. We have budget. We have, is there any way that we can work together to make sure that we can, do we have a health and hospital and a committee, or that maybe we can work together and see the services? We also have issues with homelessness in this community, people that need services now with our new fearless mayor that's saying that he wants to make sure that not incarceration or no one gets locked, to use emergency service? Are you going to create a new vibe where it can benefit the community, where someone called our office and says that there's an encampment on this location and they need services there, or he's an EDP, emotional disturbed, and might need the service of the health? Are you going to be a hospital that's going to, we can utilize it and use and say, well, this is ours, and not just a building there that's new and that we're pumping money in and getting nothing in return. So I'm sorry, that I feel that way, but I think this is a lot of taxpayer money and you're trying to build something new. I'm not putting it on you, but we have to hold people accountable. And not only are we holding you, but we're also holding our elected officials that putting money into you for you to service us. So that's I know my district manager has something to let you know.
So do I have time to try to address some of that? I don't know.
Yeah, please.
Okay. So I can only answer certain things that you brought up, right? Of course, we can get down the history lane and we acknowledge that, there is some stigma, and trust me, it's not easy to repair that. And it's not only a hospital, I guess, everywhere you go, right? If a reputation or something goes around or a review, people tend to look at that rather than maybe the other positive things. So we are not ignoring that, but, we're trying to prove that we do have a plan and we move forward. You mentioned the community needs assessment. Actually, I think we put in here in the presentation, that's going to come at the end of the year, and that's going to be shared with you guys. I don't know if it was not shared in the past. I apologize, but this year for sure you receive a copy. It's a very extensive. I think 172 surveys were completed by members of the community, and your issue of having a community advisory board was brought up in those interviews, so it was noted. We have no intention to not set up such a forum. It will benefit the community, it will benefit us, because what's better way for us to learn how to improve than just working with the community? That's why we're here tonight. I know there were some minor, micro sort of committees formed. Kevin, I may want to ask you to talk a little bit if we made any progress. There was a family advisory board. So I think we had a few attempts, but I don't think it's comprehensive to the level that, and Kathy, so please explain where we are with that. But the answer is yes, we
do
fully
have,
intend.
yes, so we do have a patient and family advisory committee. It actually meets tomorrow. We're welcome to have anybody come because it is a small group of community members, mostly retired people who kind of like we've engaged through the senior center that we've reached out to. But we would love to have a committee where more people attend, because what we do is really try and get the feedback from people who have used our facility, who have found issues. We've asked for their input about how we can make our hospital better and meet the needs of the community. We do address some of the concerns that have been brought up there about the way the nurses have treated them or the way the physicians have treated them, about any discharge issues that they've had in trying to get their prescriptions filled and such. So it meets tomorrow. We provide a lunch there so that you can come. And again, we'd love to have anybody who wants to come. The person who was the chair of our committee, who was not a hospital member, but a community member, had to step down. So we are looking for a new chair, co-chair of that committee. So we welcome anyone who would like to come, and it'll be in the third floor boardroom. And again, please just stop by or let us know who would like to attend. I believe it's at 12 noon tomorrow. I'll give you the 12 noon tomorrow. I'll give you the exact time tomorrow.
And on the last page of this presentation, we put here how we can stay in touch. There is an email that goes directly to my inbox, so I highly encourage everybody to write and say, we promise you we're not going to ignore any message we receive, right? And we will try to move forward. And again, if we need to form a more complex forum that addresses more than just what Kathy described, we're more than happy to hear from the community. And I think that gets me to what I want to say. Maybe, certain things in the past, I think it's very important communication, right? Sometimes we may even say, I don't know how many people in this room knew about the event tomorrow, right? So I don't know if the community, I think we all have to do a better job of where we disseminate the information. How does your community know what we offer? And how do we know what events you guys feel will be helpful for us to be present and answer the question? And, Celeste and Kiana have been connecting lately, and I think we're trying to improve on how we communicate and disseminate information, because sometimes you may not be aware of what we're doing and we're not aware of your needs. So I think definitely communication is something that is a work in progress, and I promise you, if we talk next time, I hope we can report there is a progress on that communication.
Then we're gonna close it out to the next upper.
Good evening. My name is Annette Spellin. I am the chair of the Civic Public Safety Health Committee for Community Board 4. My question is, how often does that, do you have that meeting? And would you please send our office, our community board office, the information so I can possibly attend?
We're gonna give you the mic if people want Zoom.
You wanna come here?
We've been meeting once a month around noon so that we can have lunch, and then we address any of the needs that the community sees that the hospital needs to address. It really is a lot of give and take about what we need to do to meet the needs of the community. They advise us, and one of the things that we've been working on is wayfinding and signs. That's something that we're, working on together with all the different construction going on. But again, we have brought them to take a look at the facilities, to see the new facilities, to see our labor and delivery unit, all that stuff. So it's been positive. Again, we've been addressing any of the concerns they have. But again, it's once a month, and I'll definitely send to you.
Thank you, Kathy. And Mr. Camacho has my cell phone, so if something goes wrong in this communication process, he knows where to find me.
Yeah, I'm sorry. We had someone here. I'm sorry.
Listen, just a quick note to add, to tie into what the question was asked about the community board meeting, the community advisory board meeting. All these new projects and these new buildings and this new growth and this expansion that our new leader is taking us on is amazing. And we all know how great this is, and we're excited because we're growing. But none of these things make sense if we don't make sure we have the voice of the community inside these buildings, inside these new programs. And the only way you really get that is what you heard Valley say, is if the community is inside with us in the form of an advisory committee. We are committing to you now the reasons why, and because it's not relevant and you're not interested in that. We don't have one. We will have a community advisory board, and it will be a commitment we're making. You've been asking for it for a long time, Mr. Camacho, and we are going to commit, and we are going to do this now, and you can hold us to it because it's what's needed, or else these things don't make sense. They just turn into buildings and structures, and that's wonderful. But if you're not in it, if there's no heartbeat, we don't need it. What do we have it for? So that's an instruction that our CEO has put on us based on these surveys that you heard that are in our community service report, that we're just not going to read and check the box, Mr. Camacho. We're going to do. You may have to give us a little time, but we're going to do, and that's our commitment to you. So just so you know.
Thank you, and thank you for coming.
Thank you very much. I appreciate you having me here.
All right, next up, we have Addison and Gabriela from El Puente in reference to the cycle 4 of the People's Money PB process. Welcome.
Hi, everyone. My name is Gabby. I'm a one-man show today. So, yeah, we're doing it. I am the Civic Engagement Coordinator at El Puente. We are a human rights organization located in Williamsburg. We also serve Bushwick. We are located on Central and Menahan, so a couple blocks away from here. Today, I am doing a workshop on behalf of the CEC, so the Civic Engagement Commission, which is a city agency meant to restore civic trust and essentially do what we were talking about a little bit earlier, which is get community input. So we've been doing all these workshops with youth centers, with high schools, and this is actually the last day of the idea generation session. So you guys are, ending it with a bang, and I'm so happy to be here and get your ideas today. So I have a mini presentation. It's a little more interactive, like compared to what we've done before. You can go to the next one. So I'm going to explain who is the CEC. So as I said, the CEC is the Civic Engagement Commission, which was brought on by a 2018 ballot initiative. Next. You can go next. Okay. We're actually gonna skip this one just because we're short on time. Yeah, so a little bit about the agenda. I'm gonna explain what this part of participatory budgeting is, and also the expense budget. So today we're gonna be working with the expense budget, which is for programs or services compared to the capital budget, which is more for construction projects. Then I'm gonna ask that each table come up with a program or a service that they would like to see. So essentially, you're just generating ideas of programs or services you would like to see in the community of Bushwick. And then for part 3, I am going to ask that we complete a short little survey. And if you are interested in what comes next, I will also offer that as well. Okay, so quickly, very just community agreements. Usually with the youth, I have like one mic, and then just being respectful of the ideas that your neighbors are generating as well, and just know that they're all coming from a good place and care for community. Okay, so part 1, we are working with the New York City budget and participatory budgeting. So as I said, we're working with the expense budget compared to the capital budget. So the expense budget is for programs or services. So I'm going to ask you to think of a workshop, a class, an outreach service, a fair, a cultural workshop, anything like that. I cannot exactly build something with the expense budget. So no repairs to parks, no repairs to potholes and stuff like that. I previously had some youth that asked me to repair the water fountains at the park with this, and I was like, no can do, sorry. Next. Okay, so yes, it can look like an after-school program at a library, compared to like, this is what we can't do. We can't repair the elevator at the train station. Yeah. We're gonna skip over the trivia just because I know you guys, you probably know all this stuff. So, yeah. So a little look at the expense budget of New York City. I know it's hard to see, but just one note that the Arts and Cultural and Department of Cultural Affairs has the smallest bit of the expense budget of New York City compared to the Department of Education, which I believe has $35 billion to just take into account. And this is a little visual, so hopefully you can see it. I don't even think the arts and cultural is not on there. It's all the way at the bottom. Okay, so a little bit of participatory budgeting. If you don't know, participatory budgeting is basically asking community members to decide what we do with the city's budget. So they allocate, I believe it's $4 million for this People's Money, which is the program that decides what the expense budget is. And yeah, so here's a quick little video just to explain it. It's probably going to be mostly audio. Yeah. There's no audio.
So if you could provide an overview since the audio is not working, just, yeah.
Yeah. No worries. So, a little overview. We are doing phase 1 of 4 phases. So today we are in the phase of idea generation. The next phase is going to be borough assemblies. And that's where community members, they apply. Mr. Camacho was famously a part of a borough assembly. So basically you apply to be a part of like a room full of people who care about what projects get put on a ballot, right? And then it becomes the voting phase. So that's the third phase. So the borough assembly basically decides out of all these ideas that community members wanted, they decide what goes on the ballot based on needs assessment and based what they think is like the best for the community. So they decide what's on the ballot. The ballot goes off to us and we do the voting phase. And after the voting phase, we collect all those ballots, count them, and then it goes to decide which organization will implement the project that won. So that is a really big deal because we just found out what is the implementation partner for our last cycle. It's going to be Bridge Street Development Corporation, which is going to be implementing the project that won last year, and it's going to be Youth Job and Opportunities Outreach. So last year there was a lot of need for job opportunities for youth, a lot of interest in construction, training, skills building for youth. And yeah, so that is just a little thing that we're doing. So today is just the idea generation phase. So you guys are going to be generating ideas. I have Paulette over here with some worksheets that's going to be handed out to each table. And there you're going to first pick your topic area. There's a few topic areas on there. You can conversate with the people around you and the people on your table. Pick your topic area. And then once you pick your topic area, you're going to let me know why this topic area deserves more funding. And then in the bubble below, there is going to be a space where you can put your program or service that you need or that you would like to see in the community. And then you're going to flip it over, tell me what borough you're representing, which is Brooklyn, right? Your zip code and also the area, the group of people that you would like to help. Okay. I think we're going to take like 5 minutes.
Yes, we're gonna give you 5 minutes to fill those things out, work it out together. Then we gonna collect them and we're gonna give them to her. I did mine. I also want to thank this young lady. Yes, I was in an assembly, and let me tell you how hard it is. You're sitting there with people from all over the boroughs, Manhattan, Queens, and everybody has different ideas and what they want. And your program and your idea has to sell. If you don't sell it, we don't get it. And the person that gets the funding is another community that then we have to help out. Meaning we're not getting the funding, but yet we got to help them to distribute what they're supposed to program and do here without no funding because they got the funding and they have to do the research and the survey. So that's what happened to us last year. So please fill it out. The clock is ticking. You got 5.
Another table, just because it's just us two. I was thinking about maybe like to another table, just because that's more. Yeah. Yeah. You gotta go too, so. Like I need more input. It makes more sense to be more. That's what I meant. Okay.
Board members, if you haven't signed in, this is also a good time to sign in so we can go through the roll call later.
Basically, typically, like an after school program, and then that goes around that. Department, being department, come in and get our call, tell them, look, we're accepting minorities, you guys can do it.
Saying, you know, but you're in response.
Well, I mean, you know, I think there are some programs for the kids. They're either or they're not really serving the stuff, right? But they are plenty of that. I think they really, you know, it's maybe halfway wasted, like if you're, $5 million for the program, that's not like, well, I already got it in my phone. Oh, right, well, yeah. What would you call it? Public transition. Into adults, so it's adolescent into adult. Yeah, that's going back to the lady. So you program that helping transition from
Attention shoppers, please continue to clear the closing door.
All right, folks on Zoom, that's time. We're going to reconvene and finish the presentation.
Okay, everyone. As Mr. Camacho said, he was part of the Borough Assembly of Brooklyn representing Bushwick. We would love to have some Bushwick community members represent our neighborhood in the Borough Assembly. Up on the screen, there's a QR code that would send you to the application. It starts over the winter, and I believe it's 6 Sundays. And it's great use of your time. If you would love to, I would so appreciate anyone who joins. And thank you so much for your time. Thank you.
Thank you. A round of applause. All right, folks, that concludes our public hearing. We're going to go through the first roll call, and then we'll ask for board members to quietly, after the first roll call, go up for their meal this evening. But the first roll call comes first. If someone can pass me the attendance sheet. Thank you. All right. Isa Abni is excused. A family member has passed away. Please keep him in your thoughts. Stephanie Anderson. Thank you. Tiani Belliard. Joanna Bennett. Robert Camacho. Tevin Campbell. Felix Ceballos. Andrew Choi. Alvina Davis. Freddie Fowler is excused. Joanna Fuentes Singh is excused. Alan Gamboa. Jason Gares. Christopher Graham. Ann Guiney. Elaine Hamilton. Zachary Hendrickson. Courtney Henley is excused. Deborah Hicks. Tanisha Honeygan.
Present.
Gotcha. Barbara Jackson. Barbara's here. Virgie Jones. Tara Jones Thomas. Luisa Jose. I saw Luisa earlier. Yeah, okay, we'll come back. If someone sees Luisa, just tell her to say she's here. Giovanni Justiniano is also excused due to a loss in the family. Please keep him in your thoughts. Nancy Keith. Thank you. Cindy LeBron. Freddie Madison. Christine Malden. Alex Moreno. Ramika Nichols Barnes. Zuma Novoa. Cirilo Nunez. Sheree Richardson. Pablo Rivera is excused. Raul Rubio. Eliseo Ruiz. Josue Salazar is excused. Milagros Sandoval. Juan Serra. Annette Spellin. B. Speederman is excused. James Stewart. Savannah Tai. Christian Tate. Ben Tucker. Jerry Valentine.
Celeste, I'm also here. I don't think I was added as a panelist.
Got you. Thanks.
Celeste, this is
Andrew.
Jerry. Yes.
Got you, Jerry. Okay, great. Anyone else whose name was called? Luisa, say you're here. Thank you. All right. Great. Let me do the tally. One moment. And Linda Whitfield is also here in person. If you don't mind signing in, please. All board members that are here in person, please sign in. Please sign in. All right, that's 26 board members in person, which constitutes a quorum. Thank you all. All right. The food. So board members can now quietly please line up to get a meal this evening, and we're going to move on with the agenda. The acceptance of the agenda. There was a suggestion this evening to move the introduction of elected officials and other representatives after the 83rd precinct report. Is there a motion for that change? James Stewart makes a motion. Is there a second? Raul Rubio beat you to it. All in favor?
Aye.
Any opposed? Any abstentions? So just to confirm, the introduction of elected officials and other representatives is now after agenda item number 5, which is the 83rd precinct report.
Yeah. Can I have acceptance of the previous meeting minutes? Wait up, one at a time, because we're taking the report, and we also have people on Zoom that may not hear. Richard, second? No, second? Raul Rubio? All in favor? Any opposed, any abstention? Motion carried. For parliamentary note, Mrs. Bennett? Please listen up. Could you please keep quiet? Thank you.
Good evening, everyone. I'm Joanna Bennett. I am the CB4 parliamentarian. Again, everybody has been following the rules so far. This evening, congratulate yourself when you speak by announcing your name and where you're from. So congratulations for everybody keeping that in mind. Please continue to do so. The other thing is to be recognized when you're called upon. You're going to be recognized by our chair, Mr. Camacho, and address your questions and concerns to him. Do not argue with one another. I had asked at the last meeting that when you're doing announcements and reading reports, to please be very conscious of your use of abbreviations, and to, at least when you first announce, for instance, a city agency, to say what that agency stands for, what that abbreviation means. It helps because we want to increase our communication. That's pretty much it, and thank you very much for your attention.
Thank you, parliamentary. We have the 8th precinct captain here. Captain, you're next. And she's a female captain. Come on, guys.
Thank you. Thank you, Camacho. Good evening, everybody. We met a few months ago, maybe a little bit over a year even. Time has flown by. As a reminder, my name is Captain Yael Magori. I've been an executive officer here at the 83rd Precinct for approximately 17 months. Very enjoyable. Who is counting, right? It is a pleasure to be here. I have the regular community members that we meet on a monthly basis. It would be very nice to see a few more people joining us on a monthly basis. We definitely need more of a diverse crowd, as in age, neighborhood, residents from different areas. It would be great to see more people. We all know that Camacho has a huge, huge heart for the community of Bushwick, and with a few members leaving soon, within a few months, we don't have really many candidates to fill in, and that's a little bit concerning. So if you are interested or involved or want to get more involved, please speak with Camacho and Community Board 4 and see how you can join and be a part of an integral piece of Bushwick. We want to keep the culture and our residents happy and alive, so it would really, really help. Secondly, I just want to mention the huge support we've had, not only from Bushwick, but from the Brooklyn North communities in regards to our officer that was shot in the face, unfortunately, on Monday. Thankfully, he was released from the hospital in a few hours with non-life-threatening injuries, and he actually walked out of that hospital alive. And that's what we want to see. We like when the communities support us. We want to do our job to help everybody stay safe. And thankfully, we got one more dangerous perpetrator off the streets. So thank you for the support always. I am going to give a brief synopsis or summary of our crime going on for the last month or so. We are in good spirits. We're in good faith that we'll continue to have no violent crimes that actually have increased. We are steadily, and I don't know if it really sounds okay, but we are going I would say in the right method of presence and keeping our cops visible. And I truly believe that helps deter anybody from becoming a victim. With that being said, our most significant concern for this past month is the index crime of grand larceny. For those that aren't familiar with the index crimes, we have 7 of them, and grand larceny is one of the lower ones. It does involve property crimes, which thankfully doesn't involve injury. And it really pertains to unattended property, being property left on the floor, your bag, left in a car, unsecured, unlocked, and somebody comes and just takes your stuff, and boom, you have a credit card now that is gone. Anything valued over $1,000 now that is gone. That is a grand larceny, and that's the area is our main concern for the past month. So the message here is really, if you're out shopping, which is now the season ahead of us, please be aware of your property, where you place it, how you secure it, who is watching it, any better ways to lock it up, hide it in your trunk if you're shopping, from store to store. And just beware of who is next to you. A lot of bumping and jostling is going on, cell phones removed from pockets, again, in the grand larceny area of that index crime. And just be aware of what is going on around you, especially if, like me, I have a lot of kids. I raised a lot of kids, still doing it. I have a lot of bags, I have the stroller, and that's really what it's about on our shopping corridors. A lot of people walking around, a lot of bags, strollers, kids. We're not really mindful of what's going on in that immediate area. So just think about one more little thing in addition to all the other things you have during the day is who is around me. Just as if you were protecting your children, grandchildren, nieces, nephews, neighbors, whatever it may be. What else can I cover? How could I forget? We have 17 new officers added to the 83rd Precinct family. So congrats to them. They are on the streets as of a week and a half ago. Yes, thank you, Camacho. Thank you. We're very proud of that. It's a significant amount. I think it's the most we've seen. How long, maybe, Officer Lopez, at like what, 2 years? It's a big number. 3 years, yeah. So we're very lucky. We're very happy to have them, especially before the holiday season. We have them posted up on Knickerbocker Corridor and Myrtle Ave. Those are like the main shopping areas that we have. They'll be out there day and night. We have 2 teams, the older rookies, as we say, and the brand new ones working the day tour hours, which I can only say, if you do see them, please stop near them, introduce yourself, say hi, offer them some kind of community tip. You are the locals, you are Bushwick. They are here to help, and they don't really know the neighborhood. So if you have anything helpful or useful, or even anything kind to say to them, congratulate them, welcome them, and let them know that they have the support from us out here. And we look forward to a very successful, crime-free, as much as possible, shopping season and holiday season. We want everybody to be safe. And if you have any concerns, please feel free to ask. Anybody? Anything at all?
We have some questions from the board.
Any?
Good evening, Joanna Bennett, CB4. I don't know if I missed it, but was it last week on the news, they reported one of the largest drug busts in Bushwick for illegal cannabis? They said that happened in Bushwick. Did the 83rd Precinct have anything to do with that?
Well, proudly we did. We weren't directly involved. There was a joint operation with a local precinct and a few smoke shops. It was a successful operation involving one of the shops and a resident in the community that happens to reside here. But the operation was initiated by a third-party organization, law enforcement, and it was a joint operation with 2 units, 2 NYPD and an outside.
I don't know, could you give the details, because this was big on the news?
It was big, and unfortunately, I'm not privy to give that information. It's a pending case, but it was a successful operation, and I appreciate you bringing it up and the acknowledgement to those officers.
Thank you for your service.
Thank you for the support. I just want to add, if anybody needs assistance with what we call a crime prevention survey, please reach out to our community affairs officer or our crime prevention officer. And what that entails is we come out to your location if you have concerns or any vulnerabilities that you think are there, and we can have our unit come out and do a survey and see if you're eligible for cameras to be installed with a subsidy through the federal funding. The applications are always pending. It is a tedious process, but we can help you through it and initiate that. If you have any questions, please. Officer Lopez from the Community Affairs in the 83rd, and Lisa Prezano, she's our crime prevention officer. She couldn't make it here.
Anyone has any questions? All right.
James Stewart, CB4. Just to follow up, is that the cameras for street or for the house?
So the funding is directly linked to institutional locations, more of churches, community centers, sites of religious, yes.
And
Sensitive.
you just reach out to Officer
Lopez, he's right here. Officer Lopez, there we go.
Reaching out to you, Officer Lopez. Thank you.
Yep. Those are the surveys. Anybody else?
I also would like to let y'all know that the captain just said we have 17 new officers, but for a couple of days they would be on different shifts. For 49 days,
45 days, yep.
45 they'll be from 7 to 3,
Those are the new ones, yep.
and then the next is from 4 to 11.
Yes, those are
So
that
remember,
17.
so just because we got 17, I just want to make sure that, oh, we got 17, they can be, no, they're rookies, and they come in at 2 separate times and 2 separate days for 45 days. So if one crew comes in 45 days from this time, then the next one goes in the next one. So please don't call officers and says, oh, we got 17 new officers. I need somebody, at night. So we got to make sure that they cover whatever it is. I just don't want y'all to think that we got 17, that it's all right.
Thank you. Thank you. So anybody else have a question, anything? Okay, thank you for your time.
Committee reports are next, starting with district office. Mr. Camacho, would you like for me to provide an overview or would you? Okay, all right. All right, so since I was in attendance, I will provide a brief overview for folks that don't know. The district office committee primarily reviews board member attendance. So we went over information as it relates to who was present, who was absent. Several board members were flagged for their absences, including Tiani Belliard, Tevin Campbell, Tara Jones-Thomas, Nancy Keefe, Cindy LeBron, Alex Moreno, Ramika Nichols-Barnes, James Stewart, and Linda Whitfield. There's full information in the report. All of this is public now, and board members are given a chance to respond, indicating their intentions. Do they want to remain on the board? Do they have to resign from the board? So on and so forth. As per the board's bylaws, they are both sent an email and a certified letter via mail with the information to be present at this meeting in advance. And the committee continues to take into consideration reasons why board members may be absent from meetings. Let's see. There were also updates in reference to protocol for the board. Should the board have to recommend removal of board members? It did not happen at this meeting, but there were meetings between the city law department, given other community boards had challenges removing board members, and it was questioned the board's process. So there was a citywide meeting with some of the boards talking about the process for removing members. Thankfully, Community Board 4 continues to be in compliance and has a very transparent process that allows for board members to speak up should they have any concerns. And then the district office report, I'm just going to give a broad level overview. We talked about building maintenance and facility updates, pest control, the building's long-term future, staffing and scheduling changes. I'll explain this one. Some folks may recall that Adelina was previously attending certain committee meetings, primarily the civic public safety, and then also the environmental protection transportation. She's now no longer attending committee meetings. Her schedule had to change based on the union, which requires her to work the same hours every single day. And more information will be shared at the upcoming executive board meeting about that and how that impacts the office. We also went through staff roles and equipment management, social media and communications, website and data organization. So if you have any interest in how the board's office functions, this is the committee for you. I highly recommend attending. And let's see what else. There were some notices within the committee mail review, a budget notice, something from the Department of Probation, the Earned Safe and Sick Time Act, testimony for the Charter Revision Commission, and then another notice from the City Law Department and Office of Management and Budget. This was joint advice. And this was about staff hiring practices. So there was a separate meeting where they explained if the board has a protocol. So for example, every board's process is different. Some have a committee that reviews how to hire staff. Some defer to the office to conduct a process to hire staff. They may have a separate process for hiring a district manager. However the board chooses to operate, they encourage the board to make it as clear as possible in the bylaws to avoid any challenges in the future. We already went over the legal advice, and let's see, that concludes this report. Thanks, everyone.
And in regards, as you know, that's on the days that you have in total to be absent. It reflects on the city charter. So we send the attendance to the borough president, and he may not appoint you in regards to your TNA. So it's not us. We have to go do our due diligence because we get audited. And if there's no quorum, we get audited. So we're a separate agency. So you want to make sure that it ain't Camacho that's doing it on his own. Like a lot of people say, that's not the way it works. There is an attendance. You got to sign in. You got to come to committee. And we send it to Borough Hall. They flag it. They flag us. And then they got to do what they have to do. It's in the city charter. Our bylaws are reflect some of the city charter. So I want to make sure that everybody understands it's not us. We're just doing our job. I'm crossing my T's and dotting my I's as the chair, because when we get audited, that'll be flagged. So please, please, please. Thank you. I wasn't there. I was absent. I had another meeting to go to.
Joanna Bennett, question. Mr. Camacho, if a board member learns that, let's say they joined a committee, and then that committee, their attendance at a committee meeting becomes a conflict because of their job, is it any difficulty in changing your committee? So there's no process. All they have to do is notify the office that they want to change committees. Very good. I think people might want to know that.
If they want to remember, don't overbook yourself when you come here. You have to come to the full board meeting, and you have to come to a committee. Some of them, and the reason why this board eliminate, because some of the people that are on executive board have to come to executive board. Some of them file for committee, then they got to come to committee, and then you got to come to the full board. You're talking about 3 meetings. So now one of those meetings you don't come to, that flag. So don't overbook yourself. Spread the wealth. That's the Brooklyn way. So let's everybody and have a quorum. That's why we double up on these committees, to make it easy on you guys. We put all those committees together. As our chair said, she chairs 100 things on there. All you got to do is come to that committee where she are, and you're good to go. And if you're on that committee, you can come to the Public Safety Committee. Even if it doesn't, even if you're not interested in it, but guess what? You might have something, or something might be happening. Then you say, oh, wait, there's the Safety Committee. I'm on that committee. Let me get on it to make sure that I can address some of the concerns or issues that my tenants may have. So that's why we double up on some of these committees, to make it less stressful. Before we had 15 committees, and we had to go, and sometimes we never had quorum because 2 people put for that one. Everybody want to put the permits and license. Nobody wants to go to health and hospital. Some of them do want to go to health and hospital because it only meets X amount of minutes. So use that as your goal to continue to stay here. Thank you.
Thank you, Mr. Camacho and Madam Parliamentarian, for asking that question for folks to know what they can do. It is a straightforward process. Just notify the office whenever anything changes. And my apologies for going out of order. I forgot that we amended the agenda. So if our elected officials and representatives can please come up if you're here in person, just make a line, name and contact information only, and then we'll go to folks on Zoom. Please raise your hand.
Good evening, everyone. I'm Jackie Reyes, Deputy Chief of Staff for Assemblymember Eric Martin Delon. Our office is located at 366 Cornelia Street, and our phone number is 718-386-4576. Thank you.
Hi, everyone. Lacey Tauber, Brooklyn Borough President Antonio Reynoso's office. My number is 718-802-3894.
Hi, good evening. This is Fran from Councilmember Sandy Nurse's office. Our phone number is 718-642-8664. Is this just info?
Good evening, everyone. Maria Valdez from the office of Senator Julia Salazar. Phone number is 718-573-1726.
Hello, everyone. My name is Juan Mayancela, Director of Community Organizing for Councilmember Jennifer Gutierrez. Phone number is 718-963-3141, and we're located at 244 Union Avenue. Thank you.
On Zoom, Jonathan?
Hello, good evening, everyone. This is Jonathan Pomboza from Brooklyn District Attorney Eric Gonzalez's office. We are located at 350 J Street in downtown Brooklyn, and our phone number is 718-250-2340. Thank you.
If there are any other representatives, community-based organizations, agencies, businesses, this is your time. Please come up in person and raise your hand on Zoom. If none, we will move on. Going once, going twice. Okay. We will move on now to the rest of the report, or actually before we do.
And I want to thank the board for allowing us to bring them up because there was a couple of issues that they were having because they say it was too long. So I wanted to bring them up, but I will not move them out of announcements because what happens is if we move them up, then guess where they go at the end of the day? They leave. And then someone may have questions for them that come late. And then our elected officials took off. So all we did was we moved up to introductions of elected officials up after the 8-3 precinct speaker. But we will not move the announcement, which is at the end, we'll give you 1.5. And the reason why we won't do that is because, I know you'll make your presentation, you do your stuff, you leave, someone comes in after, says, oh, I wanted to speak to them in regards to what they having, but you guys left. I'm sorry, I gotta be here more than what you're supposed to, but I moved you up though. Thank you.
All right, we'll move on now with our committee reports, economic development, housing and land use. Anne.
Hi, everybody. Ann Guiney. I am the chairperson of the Economic Development and Housing and Land Use Committee. We meet on the last Tuesday of the month. Everyone is welcome. We had a very busy meeting last month on the 28th, but I'll keep it short. We did not have anything to vote on. It was all informational and updates, however. So we got an update from the developer of the 349 Sudam 1250 Willoughby project. Many of the old heads here will remember this project because they have been coming before us for 10 years. And it was originally a joint increasing manufacturing and then affordable housing project. It has shifted now, at least this developer is just doing affordable housing. Because of various zoning and regulatory changes, they've increased the number of units that they were able to build from 79 to 122. So that's a positive. And they have taken a fair amount of community feedback from us. The mixture goes from 19 units for formerly homeless, 42 units at 47% AMI, which is actually sort of closer to what is right for Bushwick, 12 units at 77 and 48 units at 60%. And then 15% at 40%. 15% of them are at 40%. And the breakdowns are 31 studios, 48 one bedrooms, 34 two bedrooms, and 8 3 bedrooms. So this is a project that we as a board have supported for a long time. And we've gone back and forth with them and tried to make it better with them as well. So we got that update. There will be some community space on the first floor. Basically, they're still wrapping up their financing stuff, but they think that within about 3 years, 3 complete years from today, basically, they can start to lease it. And there is a lot of environmental remediation because it used to be a thermometer and eyeglass factory. And folks who remember old-fashioned thermometers, there was a lot of mercury. This is not good. So you got to get that out before people are living there. And then the next issues were 640 Bushwick Avenue. This is a project that had come before us in a preliminary fashion. I think we've mentioned it here. Basically, it's at the triangle at Bushwick, Myrtle, and Troutman. It is currently 2 gas stations and an auto body shop. And the proposal is to take one of those gas stations and to turn it into housing. They came before us, I believe in April, Celeste, was that it originally? And then came back for an update. We had originally said we want to see more affordability. And what we, as we looked at their proposal, they had done is they had kept the same levels basically and just made it bigger. So we said, well, wait a second. And then actually Celeste crunched the numbers, and the numbers in terms of affordability were in fact worse. There were just more of them. It was higher. It had gone from 8 to 12 stories. And so we said, well, no, I mean, this wasn't what we asked. They do require a rezoning. To do this is currently zoned commercial manufacturing, and they'd like it to go to residential. And so we said, look, we're willing to talk to you 100%. We're always willing to talk to people, but we need to see better. So there, and then the unit mix. The notes are excellent. So please, if you're interested in any of the things that I'm mentioning, please do delve into the notes because they're great. And it's bullet points. Don't worry, you don't have to get the whole madness. Okay, and then so then the next one was 946, 954 Flushing Avenue. So this was our chance to talk about quite a large proposed development. At basically it's between it's Central Avenue. If anyone's familiar with PSA 3, it's pretty much right across the street, right across the other across Flushing Avenue from Boar's Head, the factory, the meatpacking. It is currently zoned for light manufacturing. It's M11, and they would like to change that into primarily housing with a little commercial and manufacturing on the ground level. And so they had come before us with 2 proposals. One was for an 18-story building and one was for a 21-story building. And so our eyebrows did raise at that, but we listened, we heard, and we took it all in. And there was some affordability, but what they had done is to basically build a standard or propose a standard building that has, the 80-20, the mandated, the mandatory inclusionary housing, and then carve off a chunk of the site and propose to donate it to a not-for-profit developer of, potentially our choosing. As we started to dig into this and ask a lot of questions, there was no clarity about who that was, what the time frame was on that. And they said, yes, of course, we do a deed restriction so that, we would guarantee that we were giving this away. But we said, well, we want more information. We need more clarity. There's way too much of an open question for us to get behind. Then, as we continue to discuss this, Celeste, who has the memory of a amazing person, was like, well, hang on, didn't they bring before us about a year and a half ago, 18 months ago, basically the same project, but at 9 stories? And then we did ask about that, and they're like, well, the regulatory environment, the mood in the city has changed. People are really much more in favor of affordable housing. And we said, we've always been in favor of affordable housing, but we also need to, stick up for our community and our neighborhood and what is going to work best for us. So talk to us about that. And there was not a ton of feedback on that one. And so at the last meeting on the 28th, we basically, I think people said the numbers don't work and it's just too tall. It is too tall. Like precedents were given, and Bushwick Houses, which is down by Wyckoff Hospital, that's I think 16 stories, 18 stories. This is still quite a bit taller. So I think, there were some significant concerns, and we said, as it stands, this is a non-starter. We then, and I think this is important, had a conversation about if the numbers were better, would we be in favor? Because I think that's a really important we can't just say no to things or just we don't like it, it's too tall. But to really say all right, what are our values? How are we representing our values in our conversations with people? And I think that was a really robust conversation. And we are willing and interested to hear about stuff. We are not willing to give away the store, as they say. We have to stick up for our community, and they're going to do what's right for them. We're going to do what's right for us. So that was, we basically said, as it stands, this is not something that we can get behind. So that was that. Yeah. And then finally, we had started the meeting with, there's a lot of, basically a little like framework of so much technical information comes before this committee, a lot of really, specialized zoning stuff. Not, most of us are not planners. I don't think anyone on the committee, although we do have one planner on the committee, and that is great. But basically, we all want to learn more. We do the best we can to educate ourselves. And as a committee, we made a commitment to educate ourselves. We're going to be, Celeste is soliciting trainings from various groups and organizations, and we open that to the wider board. Everybody should come. And this goes for every meeting. We want everyone to come to these meetings. Like, this is, when you walk down the street and you see stuff changing, this is where you first hear it, at this committee. So we always want you, it's the last Tuesday of the month. It is next Tuesday. We will be talking about the city's proposed industrial plan, which I have taken a little look, and I will tell you as a brief foreshadowing, it does not align with a lot of things that this community board has supported in the past. I think we do believe in preserving industrial, unless there's an incredibly good trade-off for something like housing at a wonderful level. So I think this is a really important conversation to be having. And so we welcome everybody, and we hope you all come. And any questions? Thank you. Oh, there's you and then you, I believe. So you first. Oh, if you can introduce yourself too.
Good afternoon, everybody. My name is Anthony Amiwellen. I live in Bushwick, where I just moved. So that question is, where's the meeting at?
It is at 1420 Bushwick Avenue. It is at 6 p.m. next Tuesday, 3rd floor, district office.
Hi, Juan Serra, CB4 member. About the industrial plan, you said that there's a letter from, or a commentary from Evergreen. Where we can read that?
So that should be in our committee materials, which you should be able to access through. Also, I think it might even be easier than negotiating is just go to evergreen.com or evergreen.org. And this is something they're working really hard on. Evergreen, for anyone who's not familiar, they were started, I believe, in the 80s to support industrial businesses, because as many people know, Bushwick had a ton of industrial businesses. Industry has been, like manufacturing, light manufacturing has been central to this community for decades and decades, and it's been eroded. So they were formed, I believe, in the 80s as a WIDCO or something, East Williamsburg Valley, something, Industrial Development Corporation. And they changed their name to Evergreen, which is easier to say. And they really focus on making sure that our M zones are, that people who want to start businesses with light manufacturing can find places, that businesses who want to stay. So, the classic ones are like Joyva, the Wonton, that's just on the other side of Flushing Avenue, Boar's Head. But, they pay attention to Joyva's the tahini company. So there is still a lot of manufacturing. It's not as visible. Things are changing, but it is worth sticking up for. Evergreen's a terrific organization. They've supported us a lot, educating us. So yeah. Any other questions? Oh, was there one? Oh yeah, Ben.
The mic is coming.
Hi, Ben Tucker. I'm a board member. I live across the street from the development at 640 Bushwick Avenue. I'm curious if the developers will be at the next housing and land use meeting.
It's have you had any response from them?
I mean, I'm waiting for the report to be finalized so I can send
Got
it to them. And there's
My
no
bad.
plan. This is all very preliminary. And so they will make a decision on what they plan to do based on this feedback.
Okay, thanks. Yeah, I'd like to be there and weigh in. I saw in the committee notes, you proposed the idea that some residents would probably rather see it stay as a gas station than be a building with no affordability. I think that's a very good point to make. I think ultimately I'd rather see it be anything other than a gas station. And I'll just add, I don't care if it's 8 or 12 if it has the right mix of affordability. I think we've had a precedent of allowing that in the past and signing off on that in the past.
And I appreciate that. And I think that's in a sense, I mean, I think it was raised. I don't think the committee came down clearly in one way, like, no, we want a gas station. Because again, this is a block with 1 to 2 auto body shops and 2 gas stations right now. Like, that's all that is there. And apparently the finances of gas stations mean the leases turn over once every 20 years. So they had said, it'll turn over in a couple of years. We're interested in having this conversation now. Super preliminary. So, but yeah, and I think we even had told them, like, if the numbers are right, we'll talk. Anyone else? Are we all set? Thanks, everybody, and see you on Tuesday.
Great. Thanks. Thanks, Anne. Great job. And next we have permits and licenses. Christine.
Good evening, everyone. Christine Malden, Chair of the Permits and Licenses Committee. I'm going to try and stand close. I never talk loud enough. We had 8 applications this past month at the Permits and Licenses. I'm going to just read through the first 5 that we supported. Number 1 is Corner Crave at Evergreen and Palmetto. It's a wine, beer, and cider license. We actually supported this, but they were supposed to submit some updated information in the form of plans, I believe, and they did not submit those. So I'm not sure what quite happens then, but they did not send the agreed upon documentation. Next up is May Mali at 105 Wilson at Star, which is a ramen restaurant, a wine and beer license. We supported this application. Then we have Rico Chimi at 1492 Myrtle, which is kind of in a triangle with Irving and Linden, and we supported this application. Next up, Cafe Ornithology at 1037 Broadway, which is a vegan cafe. Class change to a liquor license from a wine, beer, and cider, I believe. And we did support this application. Finally, Mi Pequeña Cholula Deli Grocery. There was a class change to serve liquor. This is at 1481 Myrtle and Menahan, and we did support this application. And when we've supported these applications, it's generally, uncontroversial hours, everything seems to be in order, et cetera. So now moving on to the 3 applications that we opposed. One was Goodnight Pa at 321 Star Street at Cypress. This was the first time I had seen quite this amount of community opposition. There were 3 people who came to testify in person and about 20 or so letters of opposition that I know of. Maybe there are more. And so they came out and they said, enough, like, we're oversaturated. This is kind of in the Jefferson L area. So a lot of folks came out and spoke against it. And ultimately we stood with the community and opposed this application. Next up was Troutman Billiards, which is at 45 Irving, kind of at Troutman. This is a kind of seasoned billiards professional with several different businesses. However, the hours of operation or the hours of alcohol sales were meant to be quite late, 3 to 4 a.m. every night of the week. We tried to discuss it. We tried to negotiate, but they were not interested. So we ultimately opposed this one as well. And then finally, Xanadu at 321 Star. This is the roller rink that came before us about 6 months ago, I think, to ask for extended hours of alcohol sales till 4 a.m., 7 nights a week. We had opposed it then. It seems that they may have submitted an application anyways, but this is sort of not directly related to that, but would probably inherit whatever status, whatever decision is made about that application. This was filed as an alteration, so technically, like, on the on the premises, expansion, you know, an additional bar, cellar, a roof, something like this. But in person, when the new space was described to us, it sounded an awful lot like a completely different address on Willoughby, not on Star. So we didn't have sufficient documentation to really be able to judge because we couldn't tell from the documentation where the new space was actually. So that together with the fact that when they came before us 6 months ago, we had received a complaint about an outdoor space that is not documented or, you know, officially on the books. Nothing has been done to legalize that space. So on both of those counts, we objected to this application. So I think that is all for the new applications. Other than that, we had some good conversations. One thing that came up was Miss Bennett, I think from the, let's see, there are a lot of words here, Arts, Culture, Technology, Youth, and Education Committee. Who had signaled to us that CAMBA had identified Bushwick as an area of concern for youth, for underage liquor sales, and just wanted us to be aware of that and that perhaps, you know, trying to reduce the density or at least keep hours checked in our neighborhood would help address this particular issue. And then in terms of the committee, we also had a good conversation about really wanting the applicants to show up in person because it's a very different relationship. You know, even just having the people who are in opposition show up in person, you really understand what they're going through. And I think it's really important for the applicants to see this as well, coming from directly from the community. So we really want to strongly encourage folks to show up, applicants to show up in person. However, for practical space limitation reasons and accessibility reasons, of course, like we need to support Zoom as well. And then finally, another one of our committee members had suggested, brought up the issue of requiring applicants to obtain signatures from their direct residential neighbors. We had noticed this a couple months ago at CB1 that they ask for signatures from the neighbors on either side of the application, the liquor license application, as well as across the street and upstairs. And so Cindy had come forth with this proposal to formalize this requirement. And we actually, we made a motion to formalize this and agreed to do that. And I think that is all from the PLC Permits and Licensing Committee. Any questions? Or comments?
Hi, Stephanie Anderson, CB4. I don't know if it was mentioned, but was anything mentioned about the Jazz Club ornithology?
Yeah, I read them. We supported that application, 1037 Broadway. Did you have something to add?
Well, no, was that to for residential renting or residential lease or?
No, it was
business
just, I
lease?
believe it was to expand. They currently serve wine, beer, and cider, and this was to expand that to include hard alcohol, hard liquor. That's all.
Oh, that's it. Okay. All right. Thank you.
Good evening, Christine. Joanna Bennett, CB4. I think it might be of interest to the general. Hello, can you hear me now? That we had a couple of applicants that were unusual because they said they have grocery stores that now also want to have liquor licenses. So this was an unusual thing, and we've asked these applicants about what is your seating capacity, do you have servers, etc. This seems to be a trend that is happening in Bushwick, and people need to be aware of it. It's something new. I'd never heard of it, and it was a very concern to the community. But pay attention to what's going on. You got a lot of people applying for liquor licenses that have never applied before.
Right.
So pay attention to what is going on in Bushwick.
Yep. Thank you so much for that. Yeah, we did have a couple of applications like that. We tend to gloss over them a little bit because their hours are less controversial and they're small operations, but it's true, it's a bit of a trend, and perhaps in order to compete with the influx of all the other nightlife, they're trying to offer these services as well. But of course, especially in light of the underage sales, maybe these are a little bit more likely to do that sort of thing. So thank you for bringing that up.
Ann Guiney, CB4. Out of curiosity, how does that work? So you go and you get toilet paper and cat litter and a margarita? Like, how does this work? I don't
kind of-
understand.
Exactly. Yeah. Those were the types of questions that we asked. It sort of seems that way. Most of them have like a little seating area, and it's the closest thing I can think of that seems similar is you buy a sandwich, but instead of just buying a sandwich, you buy a sandwich and a beer or something, or, more. But yeah, they are generally convenience stores that just have like a little area carved out for 2 or 3 tables, something like this. And they're very small footprints in general. And it's not the first time, but we are starting to see a trend of those more and more.
Robert Camacho, chairperson. I am a little concerned with what's going on here in Bushwick. It's all right for us to have liquor license. It's all right for us to have cannabis. It's all right for us to have drugs stations or rehabs, but it's not all right for us to have a youth recreational facility for our kids. It's not all right for us to have a park where people are using the parks as dog parks. It's not all right for the community, and it's kind of disheartening to see that we could only drink, smoke, and have alcohol and have everything that we want. So we have to hold our elected officials accountable. Our state assemblymen, our state assemblywoman, our Congress, and we need to fight with the liquor authority because the more money they make, the more money they get. We have a sheet that we say these hours, anything past 4. You've seen the news. These kids are going out there late at night and they're going to parties and they're shooting up the place and they're drinking, and then they're saying that, oh, it wasn't in the club after they left. So their responsibility is no longer 4 in the morning when they leave and you just drunk alcohol from 4 p.m. to 4 a.m. and you can go outside and do what you want to. And no one gets no repercussion. They're not responsible because they left my establishment. 4 a.m., nothing happens good at 4 a.m. You and I know. But Bushwick is a dumping station. And no one's saying anything. And we're just comfortable by letting everybody come in. We have a sheet where we want to close things down when the liquor stops pouring in. I don't care if you stay open, but the liquor's got to stop. The alcohol has got to stop. We could have weed spots, we could have alcohol, we could have everything, but we don't have nothing for our kids and no programs and no nothing. How is that possible? So we need to fight with our elected officials, and we need to have the SLA here. Whatever happened to the 500-foot rule? This guy opens a spot, he wants 3 a.m. We make a recommendation, they second guessed us, they gave them 4 a.m. from Thursday to Saturday. The next door neighbor says, no, I want 5 a.m. When did it start? So this guy leaves that place, goes to that place, and then goes to that place, and we don't have no quality of life issues here. Come on. Where are quality of life? When are we going to say enough? When? When? We're going to have all these liquor stores. We have no stores, no nothing. When are we going to say, let's stop? And if you see the permits, because I had to call Kim to go through the SLA because there's now, someone has a spot right now that wasn't even on the radar, had over 1,000 people in there. We got 6 to 7 letters and videos that they sent us. He didn't even know. They had 1,000 people in there, and there's a video with them partying and drinking up, and then the neighbors saying 4 in the morning, 5 in the morning, they're leaving doing all that kind of stuff all over the place, and it's all right, and dumping in your block, and it's all right. So when do we say it's all right? We need the authority here. We need to speak to the commissioner. Our council assembly, they need to address this. That's all we getting here. 15, 20 licenses every day. When we say enough, when? Troutman, full. We getting another one coming in. When? So our churches, we don't get no more churches. Let's do a club in these churches. Let's get alcohol in these churches. Let's get a cannabis weed spot in these churches. Everything is legal here. Let's go back to the 60s. Come on. And nothing for our kids, and nothing for our youth, and nothing for our seniors. And then they come here and says, oh, we're going to give you a 1-bedroom. When we come, our families are in shelters. And we get a 1-bedroom with 5 kids. So nothing for the community. Like I said, and I'm going to continue saying it, we're not in college anymore. I don't need roommates, and I don't need a puppy in my house. I got family. I got grandkids, and I got kids. It's kind of disheartening to see this community and not fight with our elected officials and say, someone needs to answer these questions. Why are we having all these licenses? Why? Are they giving back to this community? Because if not, we could have a recreational facility right there on Madison and Bushwick that we've been fighting for our kids. Swimming, a pool. Where's a pool? Bushwick don't even have a pool. Yeah, Bushwick High School, but it's not ours. It's DOE. It's Go to Swimming Strong. So in order you part of that clique, you can't use it. So it's not ours. It's not ours. We really need to push it up and push the narrative. I am out 2027. By 2027, I come back in here, I'm flipping tables. If this community board is not stepping up to this community, we got to stop this. It really hurts people to see, and then we get yelled at. She had 5 to 6 videos, people sending, partying at night, urinating in people's stoop, drinking beer, dumping, loud noise. Baby can't go to school the next day. How is that possible? And double parking with the noise and the radios on. So once it finishes the club, it stays outside. This is a residential block. These are people that are living here.
Thank you, Christine. All right, we will move on with our agenda now to the chairperson's report. Mr. Camacho.
Well, I know all of y'all see me. I've been in 100 meetings already. I have my sheet here. Mostly all is informational. I guess I give them the report because, you know, we go to meetings, we go everywhere, and we try to do the best that we can for this community to uplift it. But when people want to come here and just dump stuff on us and don't respect this community, that's kind of disheartening. And, you know, there are good things happening in Bushwick. We are on October 16th. The last budget consultation was nights and parks. That same day on the 16th, me and Celeste at 4 p.m. we went to Borough Hall. We had a meeting with HR in regards to some of the issues that we were having or concerns that we were having in regards to what was going on. On the 20th, on Monday at 195 Linden, there was a working group, and we got in here in Hope Garden, Know Your Rights. As you know, ISIS is out there. People are scared. They're walking on pins and needles. They can't even stand to get food. So we're trying to organize and making sure we support our immigrant family here and making sure we protect them. They were teaching us if there is to communicate, be careful because on the gadgets they might have, if you know they're coming. And you know, back in the days when I was a kid and they were selling drugs, people always had a saying, Tato viene, ajando. Everybody know them sayings, right? That's what the cops will come and see. Y'all laughing because, yeah, I know, I was a kid, I know. And we used to say when the cops came, we would say, Tato viene bajando. That means the cops coming. And everybody knew when the cops come, because we couldn't congregate when we were kids. Now everybody can congregate and drink beer. Remember? Right in front of the cops. And when we were playing dominoes, we were drinking, they would snatch us and give us summonses. But now it's all right. Think about that one. So ICE is here, and we want to make sure our kids are scared to go to school. We're having issues in our school with the kids. So guess what happens when we have issues with our school? Funding, clothes, programming. Kids move out, our immigrants leave, pushed our people out. So it's a trend. On Tuesday the 21st, Bush Community Partners at 422 Central. That same day at 2 p.m., the RMZ presentation, CB4 on Zoom. At 6:30, the A3 Precinct Council. Wednesday, October 22nd, 2 p.m. Zoom interview with the ACU inflation and consultation with Wyckoff. They had a consultation person seeing how is it that they could get more people in there and make sure their funding are still there. On Thursday, the 23rd, 6 p.m. from 6 to 7, there was a workshop. I know some of the board members were here on OCM, Office of Cannabis Management. They were telling us, the hours of operation, the 500-foot rule that they had before. I know we had one cannabis spot that was flagged for closing down because they measured the middle of the door instead of the property line from the establishment, and they gave them a cannabis license. When this community board sent them around the corner from two schools, 274 and EBC, around the corner on Decal. So that establishment, mind you, those people in that place are giving back to this community. That establishment there. They've been giving toy drives to the people in Hope Garden, turkeys to the families here. On Thursday, tomorrow, from 12 to 4, they're going to be in the establishment giving the turkeys to the people in the community. There are tickets that they're handing out and giving. So they are giving back. It ain't that they're coming in here and dumping. There's security. They close on time because I'm right around the corner from them. And we make sure, and we had no complaints with them. Them and Emerald, which is on Saddam and Myrtle, those are the only two places. And they're giving back. And they ask, what can I continue to do? What people do? This individual went to the A3 Precinct Council and made a $500 check to the kids for the bowling alley thing. So those are the people that are giving back. He says, if I got, I'm going to give. And those were kids that were disenfranchised from Bushwick that got arrested for smoking weed and they got a license. So they want to get back to this community. And to have some people say that are we advertising weed? No, we're not. But we're advertising that they're giving back to this community and that they're here. I didn't make it legal. The states did. So that's a legal place. And they're paying their taxes and they're giving back. So we're knocking down the ones that are not legal. So let's talk about the people that are giving back to us. So on Friday the 24th, I met with a student from NYU on Green and Knoll. He wanted to find out what was going on with the parks. Thank you, parks. They put a big fence with little holes that they can't break now. Now they're writing letters to the community board saying, how can we work together with you to make sure that we can get some of the parks? Listen to what they do. They come, they dump the dogs, they do what they gotta do, they bite our kids, they break into the holes and make holes. Now they want to work with us. Now they want to work with us. Now they want us to find a place where they can. There's letters you should see. I get it in the office. We want to work because we got nowhere to take our dogs. So I got nowhere to take my kids. And you want to take my park. We're willing to work, find a location, let's get together and leave our kids' park alone. That's what I say. And our elected officials, thank you for supporting our youth and our kids and our leads that are in this community. We also want these parks to be 17 and under, not 12 and under. You know why I want them 17 and under? Because they won't mess with them 17-year-olds when they're out in the field. Because I was one of those 17 years old. This is our park. We got to teach them to take care of what they have because it's the only thing they have. Because it's not fair for them to leave this community when there's a park right across the street when they can utilize. We have PS 145 there. We have 111. It used to be 111. Now there's 3 schools at one. So we want to make sure that they have a park. And they're on the Wednesday the 5th, I went to the town hall at PS 345. I also, at that same day from 1 to 5, there was a meeting at 480 Knickerbocker at the precinct. As you know, the inspector, Olioli, is no longer there. We interviewed, there was people from within the community, interviewed 2 individuals. We don't know who they choose. We made our recommendation. It was all a secret ballot. We had now it's a scan, it's crazy. You scan your phone, you go home, you put the person you like, the reason why you chose them, and nobody know how people voted, but you know how people are. Bochinche, I call bochinche is gossip, you know, in Spanish. So we already know more or less. So we don't know who we have here. So hopefully, that's why the captain was here. Hopefully we will have an inspector at the A3 precinct. Also, that day, I also went to the Star Bar. There was a film, Juvenile. Yeah, on the Bushwick Star. Emergent City. And if you see that document, the community did their job. And you got to see it. And they wanted to change the zoning over there by the waterfront, and it did not happen. And if you look at it, you see some of the elected officials swearing one when it was time for election. The one that they choose was the one that said no, went back as an assemblywoman, and the other one went as a councilwoman. So you should see, you should listen to this. And the board chair also was removed because they had another board chair there that was the district leader of that assembly. So you got to see the film. It was great. It was good that the community stuck up to make sure that that industrial area that's there, they get the people that they wanted to get in there. You got to see it. On Monday the 10th, DYCD, we had a meeting here with DYCD, with the Department of Youth and Education Committee in regards to funding that's going on Tuesday the 11th, meeting with Aponte, CEC. I was part District Service Cabinet on Thursday on the 13th from 12 to 3. There was she told you the CEO of ribbon cutting ceremony at now the pediatric for youth is on the 2nd floor. And then Friday, the 14th at 274, we had a legislative brunch with them. Also, Saturday, the e-waste at Maria Hernandez Park. I also want to know your rights. They had another activity. And then on Sunday from 2 to 4 at the Bushwick Star that I went. And then Tuesday, the 8th, at 10, the Bushwick Community Partner, 422 Central. At 2:30, there was a meeting with our elected officials and the Murder Walk-Off Task Force. So they're trying to see if they can get someone, which I think, to get a bid for the plaza. They have one. It's going to be permanent. And I think it's going to be Ridgewood. It's going to be a temporary, I think. I'm not too sure how they're going to do it. And they're going to be doing the programming and get this stuff, because, you know, across the street is Ridgewood. I guess they want to try to they need insurance, $1 million insurance. There's a whole lot of things. Today I went to the clergy meeting and the meeting today. So I know some of the churches were having issues, and I was there encouraging them to get together and make sure that everything's all right. And that is my report.
Any questions for Mr. Camacho going once, going twice? All right, we will move on, hearing none. So good evening, everyone. This is the district manager's report now. Happy belated Veterans Day. This month is also Lung Cancer Awareness Month, National Diabetes Month, and National Native American Heritage Month. There's a lot happening in the city and beyond. It is times like these where the community provides the support that's most needed. So thank you to the board members that to continue to show up at meetings and events, as well as those who bring energy and enthusiasm to advocating for district needs. I'm also just going to add, based on our conversation this evening, something briefly. We all know that every community board is very different. And I want to talk about how I've gotten to know CB4. And I've shared this with a few board members when we check in, but there's this concept I have of a middle member. And what does that mean? That means, it doesn't mean that that board member doesn't have an opinion about something, but it means that they can see both sides. And one of the strengths that CB4 has always had is, despite our very strong opinions that may be opposed, we've always been able to see the other side and been able to take that into consideration regardless of what the outcome is. We often see, in other boards or in other circumstances, it's very easy to devolve into majority politics. Like, I have the most people on my side, I win. But that's not community. That's just one perspective. And so I just want to say thank you to everyone who continues to push that kind of leadership forward, because that is what community is all about. And I won't go over all of the meetings. I circled the very important ones that I want to make sure folks know about. But essentially, Mr. Camacho mentioned some of these. A rodent mitigation zone. It is in Bushwick. We hear from the Department of Health about what's happening here. We'll likely share more information with the Health Committee, but if folks have concerns about rodents, we know we get concerns in the office. Feel free to check in with me. I'm happy to share more information. Also make referrals. If you know an area that's concerning, let us know and we can see what we can do to help. It is the property owner's responsibility. They do give time for folks to respond to the complaints. And ultimately, it can result in an oath violation if you do not respond and they continue to find signs of rodent activity. Mr. Camacho also mentioned, I'm just going to elaborate, we did inform the 2025 Community Service Plan. This is for Wyckoff Heights Medical Center. So feedback that we receive from all of you is going directly to the hospital as well in those conversations. And then Mr. Camacho didn't mention, but the Congresswoman held a healthcare roundtable. This is very important. We all know that in the new year, healthcare is changing for many folks. And what we can do to be prepared for that. It's important to understand what's happening now. We all rely on healthcare for a variety of reasons, our family members, et cetera. So make sure to be as informed as possible. And I'm sure if you reach out to the Congresswoman's office, they'll be able to provide more recent updates on the state of the federal discussions. And I also check in on a regular basis with folks from the elected officials' offices. I spoke with Anya from Councilmember Gutierrez's office about two things. There was a CB Community Board appointment bill that was introduced, and it was in reference to changing who appoints board members. So not only was the suggestion for the borough president to appoint, but for the council members to have official appointment responsibilities. I was told that this bill doesn't seem to be going anywhere anytime soon, but I just want folks to be aware that these are parts of the conversations happening about the board that we may not otherwise hear about. And we found out through the news. That's how we learned about this happening. And we also flagged the 132 Melrose Street environmental assessment statement and asked if the council member's office can look into that project to see if there's anything the board should be aware of. And then the ribbon cutting ceremony, I want to congratulate NYC Health and Hospitals Gotham. Their site at 815 Broadway. They now have a radiology department. So folks that are in need of services, we have a site within Bushwick at our other health center. Please take advantage. And then on November 5th, we have community stakeholders that continue to take the lead on folks that are impacted by ICE's presence within the city, within Bushwick. We are having conversations about food pantry, about mutual aid. We know this is relevant not just because of ICE, but because of the recent announcements about SNAP benefits. So making sure that there is a network established in Bushwick to catch, any of those concerns. And I've been in ongoing conversations with Kim for the board social media plan. For those that follow us on Instagram and X, you will see that there have been some changes. And so we hope to continue building on that over this meeting year. And Mr. Camacho mentioned Emergent City. the documentary screening, zoning is such a nuanced and heavy topic. It's so easy to just say no to something. And even when you say no, there's still going to be impacts and outcomes. And I think that this documentary really captured that. The community held strong, but even though they said no, there were still changes that impacted that community, right? Sunset Park still was gentrified. And I think that this really prompted, I wasn't able to stay for the discussion, so I have to pick up, a few folks' brains about what happened afterward. But I really hope we could have another opportunity potentially to use this as an educational tool and a dialogue starting tool. And I very much see this as part of the committee's efforts to continue the conversation about zoning and housing in Bushwick to make sure we're prepared for whatever the future brings to us. And there was also a conversation with Common Justice. So for folks that know the organization, they reached out because they have their Communities for Safety Collective. This is a civic engagement and leadership development cohort that builds community power to find solutions to violence by addressing root causes, centering those that most impacted and separating healing services from the criminal legal system. They have a program that's coming up. The deadline to submit is November 21st. I believe that's this Friday. They will select a few participants that will be notified by December 19th. You will get a $400 stipend. The program spans 4 months. I will be forwarding this information to the board and happy to post and make this available on our website as well for folks that are interested. And MTA, as you know, the Metro card, say goodbye. Get your Metro card now if you want to keep it forever, because it's disappearing as the tokens did before. Tap and Ride is coming, and we had a briefing to talk a little bit about that transition. Folks brought up great questions like what's happening for our youth, like what kind of card will they get, what's happening for our seniors. Happy to make those notes available. Likely will be referred to the Transportation Committee. And last this morning at 8:30, the NYU Furman Center had a policy breakfast on NYC's rent stabilized housing. I listened. We had representatives from Riseboro there speaking about the challenges of managing affordable housing. It is so relevant to our conversations. We now know there will be an incoming mayor that's talked a lot about rent freezes. How will that impact everyone, right? And so happy to continue those discussions. And that concludes my report. Thank you. We are now at recommendations. I believe it's just one committee. Yes, permits and licenses. Yeah. Is Christine? Yeah, recommendations. Yeah, to recap the recommendations. Do we need a recap for folks that are here? I heard a no, but does someone want to make a motion? You can motion to blanket. You could I hear a motion to blanket. There's a second by Christian. One moment. Let me just make sure I document everyone. So that was James Stewart that made the motion to blanket. Christian Celeste Tate seconds. All in favor? Any opposed? Any abstentions? Okay, I have one opposed. Anyone else opposed to the blanket vote? Anyone else abstains from the blanket vote? All right, so motion carries. And now is there a recommendation or a motion, excuse me, for the committee's recommendations? So the blanket means they're all grouped together. And so now there could be a recommendation or a motion on what the committee has shared earlier. Yep. So Annette Spellin, I have a motion. And what's your motion, Annette? Is it in support to accept the recommendation from the committee? So I heard Stephanie Anderson's name first, seconds. All in favor? Any opposed?
Point of information, is there any a thing that we can add on in regard to our speculation sheet to make sure that we added to that to those locations that that wasn't or that were approved, to make sure that we cross our T's and dot our I's. So if the liquor authority chooses to give them whatever hours they have, that our respect or weigh in on some of these establishments that are there, because some of them said no. I understand that some of them said no and they're not going, and maybe we should enforce or let them know these are the hours that we will be giving you, and these are the hours that we have on our spec. And we encourage that the SLA do listen, because what they're going to do is we do a blanket vote. They're going to do a blanket vote in regards to their hours of operations.
Well, we're in the middle of a motion to accept. So if no one seconds that motion, well, we already had a second. So we're technically You can always make another motion once we finish this motion, if that's the case. But let me just finish out that motion. So this was a motion by Annette Smellen to accept, seconded by Stephanie. I have one opposed, which was Millie. Anyone else opposed or abstain? Elvina abstains. Okay, thank you. Anyone else abstains or opposed? I don't see any hands on Zoom. So this motion also carries. Now, would anyone else like to make a motion in reference to what Mr. Camacho said?
I want to make a motion that we put in our specs that are on there regards to the hours of operation to the individuals that said no, that they didn't want to agree to them, and make sure that we put it on there and notice that these are the hours that you people put in for them to that. If they don't have to, they don't have to. But the only way we can hold people accountable is say this community said this hour and you giving this, that's why we having these issues now. So I want to make sure that the specs that you guys put, that the liquor authority honors that. And we will have to speak with our elected officials and make sure that, because they don't give us, when they approve it, they don't send us unless we require them to tell us what were the hours you gave them. So you apply for them. We tell you these are the hours. You say, no, I want to do what I want to do. You go to them, you make a case, and they'll give you the hours. But then when something happens, then what? So
I second that. I second.
So
Good job.
seconded by Eliseo, all in favor? Any opposed, any abstentions? Hearing none, motion carries. Thank you, everyone. All right, we will move on now to old business. Any old business going once? Going twice? Hearing none, we'll move on to new business. Any new business? Yep, we have someone coming up.
I just want to bring to the attention of the community board, all the folks that are here. Someone has been breaking into our mail drop-off boxes, and they've been using a key to do it. Some of us have missed our bills, not a big deal, but the governor sent out checks. Some of us are entitled to those checks. There are those who did not get those checks. So you need to check with the governor's office to see if a check was sent out to you, because the mailbox, the drop box is being broken into. And just as an information, the senator's office knows about it. They've been working on it. I spoke to Jonathan last night. He says it's not just us. And today on the news, they say that the FBI locked up 2 people in New Jersey. So this is a big thing that's going around. Pay attention to your mail. And if for some reason you hear or you know that your box was broken into, please contact the Congresswoman's office.
Who are you before you go? Yeah.
Annette Spellin, CB4.
Thank you. Right. And we have someone else? What? That was a question if they're breaking into the relay boxes. Yeah. So there's discussion about, there's discussion about who is breaking into the post, speculation about who is breaking into the post office box.
From a law enforcement background, it's an inside job because they're using a key. Now, I've been told that our boxes along Wilson Avenue, the locks will be changed, but we don't know when. So just pay attention to your mail.
Thank you. Thank you both.
Hello, everybody. My name is Christian Vergara. I live in Bushwick, and I wanted to talk about Bill 1162. So this is a bill about suicide prevention. So it would have the Commissioner of Health report annually on suicides. And it would list it by borough, ethnicity, gender, race, basically a set number of things. Currently, the Department of Health is not regulated to report on this. They do report a couple times each year, but the reporting is at their own discretion to whatever they'd like to say. So this bill would essentially establish a set time of the year that we could get valuable data for the community. Specifically for Bushwick, suicides for the Latino community are on the rise. From 2013 to 2022, it went up to 9%, which, is obviously not a good thing. And having data like this will help us better target communities like our own so that we can create better prevention in the future. So, yeah, thank you.
Thank you. Anyone else? Last call, going once, going twice, new business? I see one hand. Olivia?
Hi, good evening. My name is Olivia. I'm a current public health student for CUNY SPH, and I want to just bring to light the Bill 1303-2025. It's a bill focused on expanding access to fertility information and education, especially around insurance for New Yorkers. Right now, currently, 1 in 8 couples are affected by infertility, for treatments are really, really costly, and usually it affects marginalized community members, and that's why I want to bring to light, especially in Bushwick, why it would be important to support this bill and to also educate the members currently about it, because it would require the Department of Health to launch a citywide multilingual public education and outreach campaign on fertility treatment and insurance coverage. And that was all. Thank you.
Thank you for being here. All right, I see no other hands, no one else in person. We will move on now to announcements, 1.5 minutes. Folks can, I hear a motion for a minute. I hear a strong motion for a minute from Barbara Jackson. One moment while I write this down. Okay. Heard. I heard a second. Whose name? Say a name. James Stewart, seconds. All in favor? Any opposed? Any abstentions? Oh, are you serious? Okay, Mr. Okay.
They got information they need, especially.
Okay. Mr. Camacho opposes. Is anyone else opposed? Virgie Jones is opposed. Anyone else opposed or abstains? So this motion still carries, and we will have just 1 minute. I will set the clock. Folks in person, please line up. And folks on Zoom, please raise your hands.
Thank you, Mr. Camacho. I'm Fran from Councilmember Nurse's office. Participatory budget ends November 28th. I have some flyers here for you to fill out. Tell us how to spend $1 million. Now's your chance to invest it in Bushwick. We have 3 tree lightings, December 6th, December 8th, and December 12th. Bushwick, Highland Park. Thank you.
Good evening. My name is Juanita James. I'm with the Brooklyn Public Library, Washington Irving. We have our calendar of events is in the back. My card is in the back. We have a friends group on December 4th, and we have a creative aging, a jewelry program for older adults, but it's not just for older adults, for anybody, starting Monday at 2:00. Thank you.
Hello, everyone. It's Juan from Councilmember Jennifer Gutierrez's office. Just a quick updates from our end. We are having a Narcan training on December 13th from 10 a.m. to 12 p.m. We're also having the Christmas lighting tree on December 8th at Knickerbocker Plaza, and then having the parade towards Maria Hernandez Park. We are collecting ideas for PB still. We're the highest district to have the most amount of votes for the past 3 years. So we're trying to have that record again for the 4th year, but we do need the ideas. So please submit how we should be spending $1 million. On December 15th at 5:30, we are having a virtual Rat Academy training through Zoom. So if you want to find out how we should be tackling the rat issues in Bushwick, please join. For anybody that has any complaints or concerns about graffiti, trash, or rats, please submit 301 complaints and reach out to our office. We will also a little advice. We have been hearing about people having concerns with their food stamps regarding the government shutdown. So please contact our office and we will reach out to HRA. And just want to say thank you to everyone who joined us for our e-waste and our domestic violence event in Bushwick. Thank you.
Is it a minute or a minute and a half? All right, cool. Hey, what's up? My name is Brizo Torres. I am the founder of the Good Good Collective nonprofit. We're artist-led, AI-powered arts education organization, all about education equity, also for our kiddos here. So we provide tuition-free programming for our kids. Our biggest program is Bushwick School of the Arts. I stay in these rooms that we talk about youth arts and education. We need youth arts education, and yet we still, our phones are not blowing up and our emails. And I'm like in the trenches here advocating for arts education for our kids here. We are blessed to have a space 449 Troutman right off the Jefferson L stop by way of Sprout Society that centers mental health. Speaking of mental health, we're all about brain health, using arts education for brain health. So we focus on nutritional food that's brain boosting for our kids. We have our after school program, and that is Monday, Wednesday, Friday. Please hit us up. We have our flyers there. We also host Bushwick Cumbia classes for adults, day camps for Thanksgiving. Thank you.
Good evening, everyone. I'm Ben Tucker. I'm the chairperson of the Environmental Protection, Transportation, Sanitation, and Parks and Recreation Committee. We did not have a committee meeting in October, which means I did not have a committee report tonight. And so I want to remind everybody there is a Google survey that board members should have all received about our potential recommendation regarding criminal summonses for e-bikes. We did not get the chance to advance that recommendation at the last board meeting. We have sent out that survey to gather feedback. We're going to be meeting this Monday, 6 p.m. on November 24th. That is the next EPTS, Environmental Protection, Transportation, Sanitation, Parks and Recreation meeting. That is Monday night at the board office, November 24th. So please fill out that survey if you haven't already so we can get some feedback on the language of this recommendation that we would be advancing. And please come to the meeting as well. Thank you.
Hi, everyone. Lacey Tauber, Brooklyn Borough President's Office. Two things. One really important thing, community board applications are open. I think it's the earliest we've ever done it. So they're going to be open through February 6th. But, you don't have to wait. You can apply now. If you need to reapply, you should have gotten an email from us so you know that you need to do it. If you're thinking about joining the board and you want to come introduce yourself and talk to me about it, please do that. And I'll be reminding you from now until February. The other thing is we are doing a drive of items to help out folks affected in Jamaica by Hurricane Melissa. We are collaborating with a bunch of elected officials from across Brooklyn. There's some flyers back there with a bunch of places around the borough where you can drop off stuff, taking bed sheets, towels, hygiene products, toiletries, medication, all kinds of stuff like that. You can drop them off at our office at Brooklyn Borough Hall, weekdays between 9 and 4, or a bunch of other places on the flyer over there. Thanks. Happy Thanksgiving.
Hi, Virgie Jones, Youth and Education Chairperson. I would just like to say thank you to Senator Salazar's office and Councilman Nurse's office. There's a tree that's been on Bushwick for a number of years, and they put a cage around it, but the other day they were cutting the top part of the tree down. So I just want to say congrats and to Community Board for supporting that, because those trees get so high and we know what happens. The second thing is that I want to say in behalf of Albany, for the Association for Black Educators of New York, we're having our annual Black History Month essay contest. And that we forwarded all the information to the schools, to the superintendent, to the district office has it. So please encourage your schools, your students to participate in this and let District 32 be represented in the House, because we need to be represented in more things with the Department of Ed. We have all the details, and the celebration will be on February 1st they're giving out gift cards, and it's for students in grade, I think it's two all the way up to high school. So thank you for your time, and we'll be talking to you later on about the scholarships that we give out every year in June for the seniors that are in the public schools. Thank you for your time and happy holidays to all.
Hello, everyone. My name is Elaine Hamilton, Community Board 4 member. Longtime resident here in Bushwick, born and raised. So what I wanted to share this evening is I'm the co-founder of the Force for Kids Foundation, which has been around since 2003. And as we do every year, we do a toy drive. So we have the toy drive coming up. This year, unfortunately, we do not have a location. So the toys and things of that nature will be delivered straight to the Children's Aid Society in Manhattan, which is who we've been working with for the past 10 years. The other thing I wanted to share is I just got back from Taiwan. I was selected by my college to represent in Taiwan as a delegate for the APEC Women's in Entrepreneurship program. Thank you. So I share this to say that and I also came back prior to that from Morocco, right, for something similar related to leadership. So I say this to say that there's so much going on in these, all around the world, right? In those specific markets, what one of my take backs is in reference to sustainability, right? And empathy and compassion. And do I have time? And compassion, things of that nature. So what I wanted to share here is I want to bring a few programs that are related to AI and things of that nature and women's empowerment and development to the Education Committee and also to the committee that you were talking about. So please, I'm interested in connecting mentors.
Maria Valdez from the Office of Senator Julia Salazar. We continue to have the tenant support unit at our office on the first Tuesday of the month from 10 a.m. to 12 p.m. We will also have an Albany 101 Town Hall on December 2nd from 6 p.m. to 8 p.m. at 280 Star Street. The senator will discuss what is her role as state senator. She will discuss also how Albany works, the legislative process, and how you can impact on legislation. I left the flyers back there. Please come and join us. Thank you.
I see Victoria on Zoom. You're muted if you're speaking. All right, we don't hear you. We can come back. Zuma on Zoom.
Yes, I think good evening, everyone. Just using my second hat.
Z, it looks like you're unmuted, but we're not able to hear you.
Okay.
Not sure what's going on. If you can drop something in the chat, it seems like there might be some technical issues. Is there anyone on Zoom going once? Going twice? All right. No more. Oh, go ahead. In person.
Sorry, Jackie, Deputy Chief of Staff for Assemblymember Eric Delon again. Just very quickly wanted to remind everyone that our office is at 366 Cornelia and we provide services Monday through Friday, 9 to 5. Any services you need, we don't turn anyone away. We provide them in English, Spanish, and ASL, including certain immigration services. So we'll do citizenship and help you renew your green cards too. Thank you.
Thank you. And I see Zuma, you want to try again really quick? And then I have a quick announcement.
Can you hear me?
Yes, we can hear you, Z.
Okay, hi, good evening. Just really quick, just an update just from Department of Health.
No, you're very low now. We can hear you, but not loud enough.
Not loud enough, I apologize. I'll try to raise my volume from my end. Just let me
Okay,
know.
yeah, it's still very low. If you want to
Very
just
low?
drop it in the chat, that might be the best.
No
Yeah,
problem.
just 'cause
no
it-
problem. No problem.
All
I'll
right.
do that.
Thank you, Z. All right, and then I just have we had a short notice item for the meeting that Ben mentioned on Monday. There's a revocable consent application for the Department of Transportation that was added to the agenda. We already sent out the newsletter, so we wanted to make sure folks know. It's for 49 Wyckoff Avenue. Essentially what they're proposing is to add entryway into the basement and a railing, but the board is required to review that application, so we'll be including that on the agenda for the hearing on Monday in case folks are interested. I see no other announcements. Going once, going twice. So we will move on to the second roll call. Board members, please be ready. In reverse order, Linda Woodfield. Was that a here? Was that a present? Okay, got you. All right. Jerry Valentine.
Present, good night.
Thank you. Ben Tucker. Christian Tate. Savannah Ty. James Stewart. Annette Spellin. Juan Serra. Milagros Sandoval. Josue Salazar's excused. Alicia Ruiz. Raul Rubio. Trey Richardson. Cirilo Nunez. Zuma Navoa.
Good night.
Gotcha, Z. Ramika Nichols Barnes. Thank you. Alex Moreno. Freddie Madison. Christine Malden. Cindy LeBron. Nancy Keith. Luisa Jose. Tara Jones Thomas. Virgie Jones. Barbara Jackson. Tanisha Honeygan.
Present.
Deborah Hicks.
Good night.
Thank you, Deborah. Zachary Hendrickson. Elaine Hamilton. Ann Guiney. Christopher Graham. Jason Gares. Alan Gamboa. Elvina Davis. Andrew Choi.
Present.
Felix Ceballos. Tevin Campbell. Robert Camacho. Joanna Bennett. Tiani Belliard. Stephanie Anderson. Is there a motion to adjourn? Barbara Jackson makes a motion to adjourn. Stephanie Anderson seconds. All in favor? Any opposed? Any abstentions? So moved. 8:47. Happy Thanksgiving, everyone.